in business, development, and humanitarian courses. Over the last 10 years, we have trained over 10,000 staff from NGOs, governments, and the United Nations in Africa. Our catalog consists of over 200 career-focused online courses to choose from, and registration for diploma and postgraduate courses is now open for the following courses: Postgraduate Diploma in Monitoring and Evaluation, Postgraduate Diploma in Water, Sanitation and Hygiene, Diploma in Community Development, Postgraduate Diploma in Strategic Planning and Management, Postgraduate Diploma in Grants Management, Diploma in Project Management, Diploma in Nutrition and Dietetics, Diploma in Gender and Development, Diploma in Leadership and Management, Diploma in Finance Management for NGOs, and many more. We have also partnered with the European International University to offer an executive MBA. Once you register, you will have access to our team of experienced trainers and specialist consultants who will guide you on your course whenever you need them. The cost for diploma courses is $800, while postgraduate courses cost $1,200. The cost of a one-year MBA course is €1,500. Visit www.capacityafrica.com for more information.
Hello, good morning, good afternoon, good evening, wherever you're logging from, ladies and gentlemen. My name is John Karegwa. I'm the Training Director of Strategia Netherlands. I'm also presenting Capacity African Institute based in Nairobi, Kenya. We want to welcome you to this session on monitoring and evaluation with a focus on outcome harvesting. Our guest today is Dr. Award Ponge, a calling professor, who is the Vice President of the Africa Evaluation Association. And I want to welcome you from wherever you're logging from. Our format today is simple. We'll take about 1 hour of your time. We will do, just do the introduction, and Professor Ponge will come in with the presentation. And then I will take questions and answers. And just to appreciate you, please let us know where you're logging from. Just indicate in the chat. Let me see where you're logging from. I know the world is presented here. Just go to the chat room and indicate there. Let's see. Kazakhstan, Yemen, Bangladesh, India, Sudan, Nigeria, Italy, Somaliland, Switzerland, Uganda. Thank you very much. Malawi, Liberia, Uganda again. Thank you. Addis, United Kingdom, Yemen. Thank you very much, Yemen. Thank you, Kenya, Zimbabwe. Thank you very much. Thank you very much for joining us. Thank you very much, Lebanon, Bulgaria, India, Serbia, Malawi, Indonesia, Tanzania, Lagos. Thank you very much. Without further ado, I'd like to introduce Professor Award Ponge, who is the Vice President of the Africa Evaluation Association. He's also a professor in Gender and Development Studies at Kenyatta University in Kenya, and is a Sasakawa Fellowship Scholar, meaning he's an accredited international development practitioner. Thank you very much, Professor Ponge. You can now take over the program. Thank you, everyone, for joining us.
Thank you so much, John, for the introduction, and thanks everyone from wherever you are tuned. Good morning, good afternoon, good evening to all of you. I have to say that I'm grateful to Capacity Africa and Strategia Netherlands for giving me this opportunity to talk to you about this topic that I'm passionate about on outcome harvesting. I don't know whether do I have the sharing rights?
Yes, you have. Yes. You are co-host.
Great.
You are the host.
Oh, great. Yes. So I'm looking at the sharing place. Are you able to see my screen?
Yes, clearly. Yes. Displaying.
Okay. Is that way you can minimize my picture so that it's not blocking the presentation? Is it okay now?
Yes.
Is it is okay, John?
Yes.
Good.
Yes.
So my topic is on outcome harvesting as an innovative participatory evaluation approach. Right.
Yes.
So yes, our main learning objectives for this session will be one, understanding the essence of outcome harvesting. The second objective will be able to decide when and why outcome harvesting can be useful. The third objective is to know the importance of customizing the 6 steps of outcome harvesting, and ultimately being able to appreciate how unexpected outcomes achieved through unplanned activities can be as rigorously evaluated as those that are predefined. Yes, so for a start, we can say that outcome harvesting has been inspired by the outcome mapping methodology. And this outcome mapping methodology, from this, the inspiration is specifically in terms of identification of the boundary partners in terms of the planning. And also outcome harvesting is inspired by utilization focused evaluation. That is having come up with our findings and recommendations. How are we able to use this to help inform future programming? So I'll share with you the father of utilization focused evaluation, who is Michael Quinn Patton. In this picture, we were with him at the IPDET program. IPDET is the International Program for Development Evaluation Training at Carleton University. And then the brain behind complexity in evaluation is Michael Bamberger. Again, there we were with him at IPDET training in Carleton University. Right. And then having been inspired by these two, complexity in evaluation and also outcome mapping and the utilization focus, Ricardo Wilson Grau did come up with this approach known as outcome harvesting. And he came up with this approach in 2013 when he was doing some work for the Ford Foundation in Asia. So out of this outcome harvesting has been added the element of context specificity. And this element of context specificity was added by Barbara Klugman. Here in this picture, we were with her during the Qatar conference in Nairobi, Kenya. So what is an outcome? Can you maybe type in the chat box what you think an outcome is? Just 1 minute. Yes, I can see result of intervention, immediate benefits, intermediate results, it brings some positive change. Good. So for purposes of outcome harvesting, when we talk about outcome, we are actually talking about a social actor taking action to change the way they do things. And a social actor in this particular case could be an individual, a group, or a community, can be an institution or an organization. And the behavior change that we are talking about in this particular case could be behavior change in terms of activities or actions, could be in terms of relationships, practices, or policies. Yes. Now, the other concept that we need to be aware of in outcome harvesting is the concept of change agent. So, who is a change agent? For our particular case, we say that a change agent could be an individual organization that influences an outcome. And what is the role of a change agent in outcome harvesting? One, they serve as key informants, and two, they help in documenting the outcomes and contribution pathways. The next concept in outcome harvesting is that one of a social actor. And we usually define a social actor in the light of the theory of change of an intervention. So for our purposes, a social actor can be an individual, can be a group or community, can be an organization or an institution. And for this purpose, there's supposed to be a behavior change manifest in this social actor. And the behavior change can be manifested at different levels. For the individual, the behavior change can be manifest in terms of activities, agendas, or relationships. For the group or community, the behavior change can be manifest in terms of activities or agendas, or in terms of relationships with other groups or other actors. For the organization, the behavior change can be manifest in all these four spheres in terms of activities, relationships, policies, and practices. And lastly, for institutions, the behavior change can be manifest at two levels, right? Can be manifest at two levels, at the level of policies or at the level of practices. Great. So, who is an outcome harvester? This is also another key concept that we have to understand in outcome harvesting. So an outcome harvester would be an internal evaluator or could be an external evaluator. But the most important thing to know about an outcome harvester is that he is the person responsible for managing the outcome harvest, right? Sorry about this technological setting. I'm trying to adjust so that I'm not able to see these things popping up on my screen. Right. So who is a harvest user? Having talked about who an outcome harvester is, a harvest user can be the person who is going to make use of the outcome harvest. Two, it can also be the donor management team for the grant portfolio. Three, outcome harvest user can be an individual organization requiring the findings to make or take action. And lastly, this could be grantee change agents, right? And the change agent in this particular case is the organization or individual making a change in the social actors that we talked about earlier. So, what is the role of an outcome harvest? So the role of an outcome harvest can be manifest at four different levels. One, for purposes of unity, it is to ensure that the outcome harvest will meet the needs of the harvest users. Two, it's supposed to be simply make the work simplified. So it is to document the outcomes that are achieved by the program. It's also supposed to be transparent, and that is to make informed decisions about the design and the implementation of an intervention. And lastly, for purposes of adaptability, it is supposed to improve the strategy of the program. Good. So in terms of comparing outcome harvesting with other evaluation approaches, we find that in outcome harvesting, we have three main spheres. And in the first sphere, which we call the sphere of control, this is the sphere where we have the inputs, the activities, and outputs. In our second sphere, we have the sphere of influence, and this is the sphere where we have our outcomes. In the first sphere, which is the sphere of control, this is at the programmatic level where we have our inputs, activities, and outputs. We may not be so much concerned with this sphere of control because this is the area where we have been given funding or we have our resources for purposes of implementing the program. But when we go to the second sphere, the sphere of influence, this is the sphere at which our concern will be most, because we want to find out who have we been able to influence through our intervention to change their behavior. So this is the area where we are talking about the social actors being influenced. And in the last sphere, this is the sphere of interest. And this, compared with other evaluation approaches, this is like the sphere of impact or the overall goal or of the intervention or of the project. So, as I was saying, it is at this sphere of control where we are investing, making our investment, right, at the sphere of control. So whatever that happens within our sphere of control is what we had promised to achieve. So when you're talking about our outcomes will not be found at this point. It will be what will come out at this sphere of control will be our outputs. Right. So generally, what is an outcome? I mean, what is outcome harvesting? So we can say that outcome harvesting is generally an approach in which evaluators, grant makers, and all program managers and staff identify, formulate, verify, analyze, and interpret outcomes in programming contexts where relations of cause and effect are not fully understood. So this is the most important thing that identifies outcome harvesting as an approach from the others, because we are talking about the element of cause and effect not being fully understood at the time of project inception. Again, for outcome harvesting, the most important thing that you have to stress on is change in behavior. That is the change in behaviors of the social actors. And we said the change in behavior can be manifest in terms of actions, activities, relationships, policies, and practices. Then again, in outcome harvesting, we do not have any predetermined outcomes. Actually, we start from the outcome that has been achieved, and then we work backwards to see how the intervention has contributed to this outcome. Then again, in outcome harvesting, we have both the intended or unintended effects or outcomes. But the most important thing is that these outcomes could be either positive or negative, but we have to capture them as they happen. Then again, in outcome harvesting, we are talking about evidence-based answers. We must come up with evaluation questions, right? Questions that are going to guide us in the evaluation or in the outcome harvesting. And these should help us establish evidence which will make us be able to generate actionable answers to the evaluation questions or the harvest questions. And lastly, outcome harvesting can also be used for monitoring or for evaluation. So in summary, we are talking about evaluators or grant makers being able to identify, formulate, verify, analyze, and interpret. And all this is about outcomes in programming contexts where the relations of cause and effect are not fully understood. So when can outcome harvesting be used? We can say that outcome harvesting can be used in contexts where the outcomes are not specific. At the point of program design, the outcomes were not specific. Two, we are focusing on outcomes and not activities. The primary focus of outcome harvesting is the outcome itself and not the activities. But this does not mean that the activities are not relevant. The activities are also going to be captured, but in terms of how did the intervention contribute to these outcomes? And the third point is that we are looking for programming contexts which are complex. And we mentioned that complex programs are programs in which the relations of cause and effect are not fully understood. And lastly, we say that the purpose is evaluation. So outcome harvesting can be used to track the changes in behavior of the social actors as influenced by the intervention. Right. So who should be involved in outcome harvesting? So we have 4 categories of people who should be involved in outcome harvesting. The first category are the outcome harvesters. And here we talked about the internal or external evaluators, as well as the donor representatives. 2, we have the harvest users. And the harvest users, we already mentioned that these are individuals or organizations requiring the findings to make decisions or take action. And we have key informants. And key informants in this particular case are persons who are knowledgeable about what the intervention has achieved and how it has achieved this, and they are willing to share the information with the outcome harvesters. And lastly, we have the field staff. So the field staff, in this particular case, are people who are closest to the actions, right? And they tend to be the best informed. They're the people who are knowledgeable about this information in terms of either being part of the implementation team or being part of, say, beneficiaries of the intervention, something like that. Good. So I think the next thing we want to discuss is how to differentiate outputs, outcomes, and impacts. I would have told you to do this in your chat box, but because time may not be on our side, I just want to give you a story which can illustrate what we are talking about in terms of the differences between outputs, outcomes, and impacts. And this is a fish soup development story. This story was inspired by one of my colleagues in a former assignment called Connie Hoytings, working for Wetlands International, the Netherlands. And the story really impressed me because it really tries to simplify the differences in these 3 concepts that usually confuse so many people. In this fish soup development story, we have, for our start, the inputs or the resources. In this particular case, we have the parents who get together fish, fresh vegetables, water, grains, the pot, and the source of heat. These are the inputs that we have at the program level. Then, from these inputs or resources, we have our activities. And in this particular case, it is the mother or the father carefully preparing and cooking all the ingredients. The next step, we go to the output stage, where the children are served and taste the most nourishing fish soup in the world. From the outputs, we get our outcomes. And one of the outcomes says that children consider the soup delicious and they begin demanding fish soup weekly. And then from this, our impact is that children are healthy adults. So my question is, from this, what you have just presented here about the soup, fish soup development, how do you believe that these three results are different? The outputs, the outcomes, and the impact, the one at the top. Looking at this, you find that the first three items, the inputs or resources, the activities, and the outputs, these are under the control of the parents. The parents are able to control what happens at these three different levels. And this parents' control is comparable to our first sphere that we have talked about, the sphere of control. When you go to the second one, where we have the level of outcomes, this is at the parents' influence. The parents are able to influence children in this particular case, who now consider the soup delicious and they begin demanding this. Yeah. So the parents' influence level is comparable to our second level where we talked about the sphere of influence. And ultimately, the last level, the level of impact, this is what is at the level of the parents' worry. What are the parents worried about? What is it that they want to achieve ultimately? Their children is that the children are healthy adults. So that is the overall impact. But you also need to understand that from just one output, like children are served and taste the most nourishing fish soup, we can get so many different outcomes. Like the first one there is that children consider the soup delicious and they begin to demand for it weekly. Children invite friends also to come and have fish soup for dinner. That's another outcome. Another outcome, children learn how to cook great-grandmother's fish soup. Another outcome, some mothers ask for the recipe for making this fish soup. From the same output, we are able to to get all these outcomes. The neighbors begin to serve fish soup to their children. Some local library features great-grandmother's fish soup. And then the local priest can declare Friday as a day of meat fasting. And when they declare a day of meat fasting, it means that the people now resort to fish, or possibly fish soup. Ultimately, the impact is that children are healthy adults. Good. Up to that level, we want to find out now, when is outcome harvesting not useful? And here, we can say that outcome harvesting is not useful when monitoring and evaluating projects and programs for which the logic model is well proven. If we know from our logic model, right, that if we do activity A, this one will lead us to outcome B, right? It is a linear kind of relationship from A to B. Then in such kind of instance, we may have to use the traditional evaluation methodologies. Yeah, but if the logic model is not well proven at the point of project inception, examples can be in infrastructure development, for example, in technology transfer, in delivering healthcare, and also in primary education services, where you know that if you teach these kids A, B, C, they're supposed to produce this. In such kind of interventions, we may not use outcome harvesting. However, outcome harvesting can be useful when we are monitoring and evaluating projects and programs in complex contexts, right? We talked of the element of complexity. And these are, for example, programs that aim to solve intractable development problems with innovative solutions. Two, programs that require that you influence social actors to change their behavior. Programs Then influencing people to change their environmental practices, that's also a change in behavior. For example, mobilizing support for HIV and AIDS action, right? Persuading religious authorities, right, to adopt some practices. For example, if you want to, for example, make the Catholic Church embrace something like same-sex relationship and things like that, right? Yeah. If you have such kind of a program that tries to make them change their behavior or perceptions about some activity, right? Or for example, lobby for new legislation, say in a country where LGBT is looked down upon, and you're now coming up with an intervention to try to lobby legislators to come up with a legislation that appreciates same-sex relationships and things like that. So in such kind of complex context, we may have to use outcome harvesting to evaluate the same. So what are the main differences between traditional evaluation and outcome harvesting evaluation? One, in traditional evaluation, we are talking about predetermined outcomes, whereas for outcome harvesting, we are simply assessing what has been achieved. What has been achieved, whether it was intended or unintended, but it has been achieved, we are assessing that. Two, in traditional evaluation, the evaluators are normally perceived as independent and objective actors, whereas for outcome harvesting, evaluators are just part of a team and they are perceived as collaborators, right? It's a collaborative approach to outcome harvesting. You can maybe call it even participatory. Traditional evaluation provides judgment on success or failure of an intervention, whereas for outcome harvesting, it provides evidence of what outcomes were achieved, right? In traditional evaluation, we are concerned about fidelity to the logic model. For outcome harvesting, our focus in what actually happens, whether it was intended or not. In traditional evaluation, accountability emphasis is external, especially to funders. For outcome harvesting, accountability centers on the primary intended users and the principal uses for the outcome harvesting. Right. So the main strength of outcome harvesting, one, it captures all the outcomes, right? And it overcomes the common failure to search for unintended outcomes or interventions, right? Because it's starting from the outcome itself, it will be able to capture everything, whether it was intended or not intended. Two, the outcomes outcome harvesting generates verifiable outcomes, right? And people have said that outcome harvesting uses a common sense, accessible approach. Yeah, it may be common sense, but at least you need to have some skills in how to engage in the process and also engaging the actors. In terms of methodology, it employs various data collection methods, just like traditional evaluation methodologies, such as face-to-face, telephone, workshops, and document review. And also in the case of during the COVID situation, we even had outcome harvesting workshops conducted virtually. And most important is that the answers we get from our outcome harvest, right, are supposed to be actionable and with concrete evidence. Right. So any limitations or weaknesses of outcome harvesting as an approach, one, the awareness demands, yeah? So it means that only those outcomes that the informants are aware of, only those are captured. Whatever is in the documentation and what we're able to get from the key informants, only that is captured. Whatever they do not know about, whether it was an outcome or not, that is not captured. Then the element of the change agent role, the participation of those who influence the outcomes is crucial, right? That's we're conducting outcome harvesting. That's why you see in one of the steps we have to involve the change agent. So their role is really critical here. In instances where we have a turnover of staff, for example, in an organization implementing a project, then there will be that element of lack of institutional memory in the change agent, and that this may lead also to not capturing all the outcomes effectively. Then there's the skill and time, as well as timeliness. These are required to identify and formulate high quality outcome descriptions. And then this is a new way of thinking, and most people do not like a new way of thinking. For example, like in this one, where it works the way the pathologists work. They start from the death of a person, so that is the outcome, and then working backwards to try to find out what could have caused the death of that person. So those are some of the limitations of outcome harvesting as an approach. Now, what do you understand by the term complexity? Because we've been talking about this element of complexity, and you're saying that for outcome harvesting, it works best in context of complexity, where okay. I think I'm preempting this. But I want you to tell me what you understand by the term complexity. Any ideas? Maybe you can put in the chat box what you understand by complexity. You've already talked about this. Change is not linear. Intervention that is not linear. Hard to understand. Complexity meaning over change is something. The result changes are not very clearly defined. Right. I think all of you are right. So what we mean by complexity in this particular case is that at the moment of planning, the project designers and implementers, they faced substantial uncertainty about the relationship of cause and effect. And it's because of this that there's a lady, Brenda Zimmerman. Brenda Zimmerman, we use her matrix, which tries to give an illustration of what a complex intervention is. Yeah, and according to this matrix, we can see that on the horizontal axis, we have close to agreement and far from agreement at the top. Then on the horizontal axis, we have close to certainty and far from certainty. What this means is that on the horizontal vertical axis, we are talking about agreement about the intervention in terms of its activities and solutions to a problem, And then on the horizontal side, we are talking about certainty of the effects or impacts of this intervention. So when the agreement is close and the certainty is also close, in that particular sector, we have a simple intervention. Then in the next level, we have the complicated intervention. The more you move far away from agreement about a solution to an intervention or to a problem, and also uncertain about its impacts, we are moving more to complex situations. And then the topmost, where we have farthest in terms of agreement and farthest in terms of certainty, that is a chaotic context. And then this one can be understood again using the David Snowden's Sinafin, which tries now to give us some possible indications of what is entailed in each of these sectors or these parts of the matrix. So here we are given the simple intervention. Here in simple intervention, the cause and effect relations are repeatable. For complicated interventions, the cause and effect are separated over time and space. for complex interventions, and these are the interventions in which we will apply the outcome harvesting approach, the cause and effect are only coherent in retrospect. And that's why it is more of a retrospect approach to evaluation. And then the last one down here is a chaotic situation. So there's completely no cause and effect relationships that can be perceived in these chaotic situations. And it may be extremely difficult to do an evaluation of an intervention that was implemented in a chaotic situation. Good. So what we are saying about complexity in this particular case are two things. One, that we are talking about multiple actors. So complexity arises in any system in which many agents interact and adapt to one another and also to their environments. Two, there are adaptations, just as you mentioned in the first one, interaction among many agents and adaptation. And these adaptations result in evolutionary processes, which are often surprising emergent behaviors, say at the macro level. So we have multiple actors and adaptations. Multiple actors and adaptation. And in terms of behavior change, we can use these three circles to illustrate what really is involved in terms of determining the behavior change, as behavior change is the most important aspect of what we're looking for in outcome harvesting. So what determines behavior change? One is capability, that is the psychological or physical ability of an actor to enact a behavior. Then two, you're talking about the opportunity, which could be the physical and social environment that enables that behavior change to flourish. And then the motivation. What is it that motivates the actor? These are the reflective and automatic mechanisms that activate or inhibit a behavior. So this is what has been referred to as the COM-B for behavior change determination. Right. So how do you determine complexity? This one will really help us so as to know when to apply outcome harvesting as an approach to an intervention. Yeah, by simply determining whether the intervention, the implementation complex, implementation context was complex or not. So the first one is the distance between cause and effect. This one can be long in time. Two, there are several causes for any change that occur, right? And causality in this particular case can be understood as multiple at best. There's no one single causality that A causes B. There could be some other factors intervening. Then change, and change in this particular case, we are talking about behavioral change. It occurs through qualitative leaps and bounds, and it's not incremental or proportional, right? Then this one again is related to this next point, where there are no proportional relationship between the size of cause and effect, right? You can have a very minimal contribution to an intervention, but this minimal contribution can have very great impact or very strong outcomes, right? And you may also have very great contributions to an intervention, but the outcome or the impact may be very minimal. So there's no proportional relationships between the size of cause and effect. Then the boundary conditions play a major role in explaining how change occurs. And this is the element where we talk about the multiplicity of actors in a complex context. Then it also depends on a large number of interventions. There could be so many interventions happening in the same context, but all of them related in one way or the other and having an impact on an outcome that you want to report for an intervention. And then the feedback loops, these can either be positive or negative. Right. So we are saying that for simple interventions, these are interventions in which the relationship of cause and effect are known, right? So maybe in a chat box, just 1 minute, write a simple development challenge, which at the time of planning, you know or knew that if you do A, the result will be B. That is a simple development challenge. 1 minute on the chat box. Destination trials. Cash support for family, for food, family gets food. Changes in girls' education, school feeding, road construction, borehole, water access, provision of pumps, school construction. Good. I think all these are simple development interventions. So for the monitoring and evaluation of a simple intervention, we are asking ourselves at the level of input activities and outputs, are we really efficient? Yes. And for outcomes and the impact level, we are asking the question, are we really effective? And you can see this is a linear dimension from the inputs all the way to the impact. It is linear. You know that if you have the following inputs and you do these activities, you are going to achieve that. For example, another person gave there is installing village boreholes, right? That is a simple intervention. And for complex interventions, these are interventions in which relationships of cause and effect are unknown, right? Again, 1 minute. Write a complex development challenge where, where at the moment of planning, there was considerable uncertainty about what the results will be if you do what you plan. 1 minute on the chat box. What a complex development intervention. Advocacy or policy change, reducing child marriage, right? Gender-based violence, investment in climate change, systems development, alternative, changing social stigma, value chain development, behavioral change interventions, women empowerment. Great. I think these are right manifestations of complex development challenges. Right. And for the monitoring and evaluation of a complex intervention, as you can see, it is not linear at all, right? Because from outputs, activities, inputs, and these then some deviate because of some intervening variables. Output goes this way, outcome, and ultimately we are talking about our vision, and the pathways are not linear completely. So an example of this can be achieving environmentally sustainable and equitable governance of water and water sanitation and health project. So that's an example of a complex intervention. And these other examples have been given by you on the chat box. So for simple interventions, the dimensions in which the relationships of cause and effect are known. So it is either this or this. You do this and you achieve this. You don't do this, you don't achieve this, right? But for complex interventions, it's not either or, right? Because we have unknown relationships of cause and effect, and then the results are substantially unforeseeable in complex contexts. So, in summary, outcome harvesting and complexity, we are saying that the greater the disagreement about what the development challenge is, the greater the disagreement about what its solution is, solution to that development challenge you talked about in number 1. And then the greater the uncertainty about what the results would be, the results of this intervention to solve a development challenge, if the greater the uncertainty. So when all these 3 conditions present, then the more outcome harvesting may be useful as an evaluation approach. Good. That said, now I want us to go to the outcome harvesting now as a process. Outcome harvesting as a process, right? And in outcome harvesting, we have 6 main steps, right? And the first step, we are talking about the design of the harvest, right? And in the design of the harvest, the evaluation team is working with the stakeholders, in this particular case, the client and other members of the implementation team, to determine what is the purpose of the evaluation, right? And it's at this stage that, again, you are agreeing on the usable evaluation questions that will guide the outcome harvest. And most importantly, we are also asking about questions about which will help us determine how can we make use of the outcome harvest findings. So this is really critical in the first step. And in determining some of the evaluation questions, which again you have to work with, the outcome harvester has to work with the key stakeholders and the client. We are asking, for example, what are the positive and negative, intended and unintended outcomes of the intervention, right? What did the project do that contributed to these outcomes? And how adaptive have these outcomes been in response, these activities been in response to the outcomes that have been achieved in this particular context. In this particular case, we're looking about the contribution of the intervention to the outcomes. And lastly, we are talking about the sustainability of the outcomes that we have achieved through this intervention that has been implemented. So what are the indications that this change that we have observed, this behavior change, will continue beyond the program times or the program timeline, right? Good. So in the second step, we are talking about review of documentation. This is just similar to what we do in review of documentation in a traditional evaluation methodology, where the evaluation team will be given some of the relevant written documents. This could be annual reports, regular monitoring reports, evaluation reports, and it is from these that the outcome harvester should be able to identify potential outcomes of what the program did to contribute and what the program did to contribute to them. And when we are doing this, during the document review, we are seeding out information about behavior change, right? In terms of the individuals, groups, or communities, and how the project or the intervention contributed to this behavior change. And most important here is that we are not talking about the behavior change in terms of the change agent. We are not talking about the behavior change in the project implementation team, but we are talking about behavior change in terms of that second sphere we talked about, the sphere of influence, right? What the parent are able to influence. So that sphere of influence is what we are looking for in this particular case, the behavior change at the influence level, right? And then after this, in step 2, we compile a list of the potential outcome statements. These are still not final outcome statements. They are just potential outcome statements. And this one you will have to share with the knowledgeable persons. And in the process, you may find that there are some which we could be attributing to this intervention, but in a sense, they are not outcomes of this intervention. So In our step 2, from our step 2, we go to our third step. And in this third step is the step where we are engaging with the informants, right? So we are engaging with the informants. These are people who are most knowledgeable about the program, right? And we've already shared with them some of the potential outcomes that we have got from reading of the literature, right? So from this, the outcome statements that you have come up with describe in detail the description of the outcome, what is the significance of the outcome, and what was the contribution of this intervention to the outcome, right? And when you're talking about the description, this can be just maybe a sentence or even an entire page or just a paragraph, but most important when you're talking about a description, as you'll see in the next few slides, we are talking about what happened, where, when, and how. Yeah, and what we're talking about in this particular case is the behavior. What behavior changed? Whose behavior changed? When did this behavior change? And how? So how did the project contribute to this behavior change, right? And it must be time specific so as to be able to know whether it could have been an outcome of another intervention or it is an outcome of our intervention, the one that we are evaluating, right? So, sorry. After working with the knowledgeable persons in step 3 to try to see what outcomes this intervention contributed to and which ones it did not contribute to, and potentially adding other outcomes which may not be in the documentation. For example, when we are conducting outcome harvesting, you are given some literature that has been approved already, but you find that there are some maybe monitoring reports which had not been approved by the time you are given the reading. So these ones are some of the literature you will continue to review as you continue with the outcome harvest process. So after we've collected all these, we have to substantiate the outcomes, right? And this substantiation to know whether or not these outcomes are significant in relation to the program theory of change, and again, whether or not the intervention contributed to these outcomes. And for this substantiation stage, this can be done in 2 different ways. One, it can be done through document review as a continuation of review from what we had already reviewed and any additional literature, or it can be done by interviewing people who are independent of the program, but they are knowledgeable about the outcomes, right? So that's the second way in which we can do substantiation of the outcomes. Then after substantiating the outcomes, then we go to the next stage, which is the stage of analyzing the outcomes. So in analyzing the outcomes, we categorize the outcomes, right? I mean, after substantiating the outcomes, we analyze them. And in terms of analyzing, one, we categorize and then analyze. And in terms of categorization, this usually happens in different ways. The client gives instruction to the outcome harvester on how the outcomes should be categorized. For example, in relation to the objectives of the evaluation, so the categorization can be in terms of objectives. 2, there are some clients who insist that the categorization should be based on the OECD DAC evaluation criteria. Yes, so where we can talk of the effectiveness, efficiency, relevance, impact, and sustainability. And you can possibly even add the element of coherence. So if the client wants you to go that way, you can also categorize them based on that. And another possible categorization could be in terms of emerging themes. As you are substantiating these outcomes and trying to analyze them, you realize that there are some themes that are emerging. For example, this is a theme about stakeholder engagement. This is a theme about maybe challenges of 1, 2, 3, something like that. So you can also categorize based on emerging themes. After categorizing these, then you will analyze the data to provide evidence-based answers to the questions that we had already developed in step 1, the evaluation questions. And then lastly, in step 6, now we share our findings and possibly our recommendations for purposes of learning, right? We share our findings with our clients and other stakeholders, and we try to make sense of the outcome harvest findings. And this is for purposes of facilitating a conversation of how we can learn from this evaluation. So the 6 steps that we just talked about in outcome harvesting are, the first one is the design phase. The second phase is the review of documentation. The third phase is where we engage with the key informants or the human sources. The fourth stage is the step of substantiating the outcomes to know which one the intervention contributed to and which ones are not outcomes of the intervention. The next element is, or step, is to categorize these outcomes, analyze them, interpret them, and get possible recommendations, which lead us to the 6th step, which is supporting a use of findings. And this again now draws us back to our earlier inspiration, where we talked of outcome harvesting having been inspired by outcome mapping, and also influenced by outcome mapping and inspired by utilization focused evaluation. So the key principles that can guide us in terms of outcome harvesting are 3. 1, it's a collaborative approach. 2, it is participatory. And 3, it is an empowering approach, where we help the beneficiaries or even the project team, to learn about the process of doing this, so that as you do the outcome harvesting with them, they also learn the trade, so that going forward they can implement it in themselves. And in this way, you can see in the empowerment illustration, the evaluator, having empowered the people, sits at the back and then lets the people lead in the evaluation. Right. Good. So what is the role of the key stakeholders in outcome harvesting? So your role actually can be like 4-fold. 1, in description of the outcomes, right? You'll help the outcome harvester in coming up with descriptions of the outcomes. 2, you will try to identify whether the outcomes are significant or not. And in this particular case, we are talking about something being innovative, something that is out of the ordinary, and something that is really eye-catching. And this significance must always be in relation to the program theory of change. And then 3, we want you to help in identifying the contribution of the project or the intervention, the outcome, right? The challenge has been that some project staff try to, because they're implementing multiple projects, right? They try to bring outcomes of other projects to try to report them as outcomes of this intervention that we are evaluating. So in this process, through the substantiation process, we'll be able to see what the project did not contribute to and what it contributed to. So in our outcome statement, we will have the description, the significance, and the contribution. Beyond this, we will also help the stakeholders will help the outcome harvester in identification of substantiators. And the substantiators in this particular case are people who are knowledgeable about the project, but who did not take part in the project implementation. So in outcome description, here we are talking about an outcome, which is a behavior change, and this behavior change must have been influenced by your actions as a project implementation team. The project implementation team in this particular case is what we had earlier referred to as the change agent. So we are asking, who changed what, when, and where, right? An example of an outcome description is this one. The Mpwapwa Sub-County Medical Officer of Health has established regular communications with most of the health facilities in his sub-county through quarterly supervision visits and monthly data reviews. As a result, service delivery has increased, particularly for young expectant mothers. By July 2020, the sub-county reported a 90% increase among young mothers coming to deliver in health facilities, an increase from 68%. So what we are talking about here is that in outcome description, the most important things are whose behavior changed or who did what. In this particular case, it is the medical officer of health. Where did this happen? The where is the Mpwapwa sub-county, right? What is it that happened? What was the behavior change that has been manifest? The behavior change in this particular case is establishment of regular communications with most of the health facilities in the sub-county, right? When did this happen? This happened in July 2020. So this one constitutes an outcome description. Having come up with this outcome description, the next thing we are talking about is significance of the outcome, right? And for significance, we are asking ourselves, yeah, is it generally a new practice? Is it a breakthrough from old habits? Or is it something that is a step towards long-term change? And as I mentioned earlier, when you're talking of significance, this should always be in relation to the theory of change, right? An example of significance in this particular case, we can say, Kilifi County, this is in Kenya, where Mpwapwa sub-county is located, is unable to provide funds for supportive supervision visits to Mpwapwa Sub-County Health Center. As a result, the visits were not being conducted and service delivery was suffering in the sub-county, right? So after the SLALE training, SLALE is a project on strengthening local advocacy leadership in East Africa, a project that was conducted by DSW in Kenya and in Tanzania. So after this SLALE training, DAIO is one of the civil society organizations that were implementing, one of the implementing partners. DAIO helped the health department in engaging with all potential funding partners, right? Rather than just targeting particular partners. This has seen an increase in partner funding for supportive supervision. So the most important thing is here is the training of DAIO conducting a training of the medical officers of health in that particular county, and then also engaging different funding partners, right? And as a result of this, so many funding partners have come up to support supportive supervision visits in the county. Right. Now, how did the project contribute to this? And for the contribution, we are looking for a brief description of how the intervention influenced the social actor, right, as it relates to this outcome. The social actors we're talking about in this particular case are the medical officers of health who have been trained and also who have had a capacity of engaging with the partners, right, for purposes of funding. And this contribution can be partially, indirectly, or even unintentionally. As we are talking about a complex situation where we have multiplicity of actors, there could be other actors also or other programs that have impacted on these medical officers of health. So what we are saying here is that our intervention has contributed to this extent, not that our intervention is directly responsible for this outcome, right? And for contribution, we can say, as an example, the improper sub-county medical officer of health, who is a beneficiary of the training, used a stakeholder analysis and mapping to garner funding for supervision visits to the health facilities in his sub-county. Along with this team, he mapped out 6 partners and approached 4 of them. He targeted his proposals to the partners' priorities, identifying partner priority, something that they were taught in that training, and then divided the activities among the partners, you to fund this, you to fund this, you to fund this, so that one partner is not overwhelmed with funding requests, right? The partners shared their annual work plans and how they could support the sub-county in their activities. And as a result of this, there was increased funding, and then there was increased support supervision in the health facilities. And as a result of this, service delivery has increased. And for example, reported viral suppression among patients has decreased, right? Yes. So another example of a contribution, SLALE strengthened the capacity of the youth-led civil society organizations in September 2020. The contribution also should be time-bound, because we want to find out whether by the time you are making this contribution, this project has already started or not, right? And this will help us in substantiation, where you may find that what the organization did was well before the program we are evaluating started. So you have to mention in September 2020, in their roles and responsibilities, and of the family planning and reproductive health advocacy in enhancing sexual and reproductive health service delivery in the country. This one is in Tanzania. Doyodo, a civil society organization, Dodoma Youth Development Organization, convened the Stakeholder Engagement Forum on 15th of February 2019, bringing together 55 participants from government, CSOs, private sector, FPRH associations, SRH associations, and other FPRH sector players, which provided a platform for dialogue and mobilization of partners for collective action, thus including enhanced advocacy for family planning and reproductive health rights and service delivery. This is also another example of a contribution. So lastly, we are talking about substantiators. And for substantiators here, we are looking for either a document or a name of a person that can verify an outcome. And for a person, this must be a person who is independent of the project, but is knowledgeable about the outcome. 2, the person must be a credible person insofar as the thematic area is concerned. And lastly, the person must be a person of influence in the thematic area that we are reporting about. So I think that summarizes what we are looking for in the 6 steps, and also in terms of our outcome description, the significance of the outcome, as well as the contribution of the intervention to the outcome. So thank you so much for listening, and sorry for taking longer than anticipated. Thank you all.
Thank you very much, Professor Ponge, for the presentation. Very beautiful. I'm sure we've learned a lot. At this stage, I would like to take questions. So if you have any questions for Dr. Pombe, please raise your hand and we go straight into that business. I'm sure there are questions. We'll take them as they come. Let's see how many. Please raise your hand so that then we can unmute you and you can get to raise your question. And the first question is from Adewale Tafade. Nick, please unmute Adewale, and please, Adewale, raise your question. Thank you.
Okay, thank you. Thank you very much for this privilege. This is very, very insightful. And I'm grateful to the friends that shared the link for me to attend. The outcome harvesting is a newly imagined area. We are used to surveys, annual surveys, midterm evaluations, and all the likes. I just want to ask. I'm looking at the annual the outcome harvesting. It seems like somebody like an internal staff cannot conduct an outcome harvesting. I just want to know, is it better to just have whatever observation you have, maybe market behavior changes as like an hypothesis, then you call an external person to come and do the outcome harvesting, or is something that can be done internally? What role will the team member play to conduct an outcome harvesting versus getting someone outside? Thank you.
Thank you. Professor, you can answer that question right away if you got it.
Yes, thank you so much, Adewale. Yes, for that, for the compliments and also for the question. You want to find out if internal staff can conduct outcome harvesting or not, and what is their role. Right. I think you'll remember when I mentioned, I was talking about who is an outcome harvester. And in that particular slide, I had like two tabs. One tab was about internal evaluation staff, and the other tab was for external evaluation staff. So outcome harvesting can be conducted both by internal evaluation staff or even external evaluators, like for example, a consultant, right? And why we are saying this is because this is a participatory and learning process, right? Internally, over time, organizations are beginning to learn to use outcome harvesting for purposes of monitoring as well as for evaluation. Initially, it was designed for evaluation, but now organizations are adjusting and adopting outcome harvesting to also be part of evaluation. And as you can see, the 6 steps that are involved in the outcome harvesting, they are, they're applicable both to internal staff as well as the external staff. The only difference would be in the substantiation. Who substantiates? Because you are the internal staff, you are a part of the implementing team, then how do you substantiate your own outcomes? Here is where you can either substantiate through document review or the regular staff, the regular visits to the implementation sites. So that is the possible role of the internal staff in conducting outcome analysis.
Thank you very much. The next question is from Thelma. I can see your hand is up. Thelma, please raise your question. Nikron, please unmute Thelma. Thelma Lambda. Thank you.
Okay, good morning and thank you very much for this presentation. Actually, I'm currently in the field and I have to carry out outcome harvesting. So this is just telling me what to do exactly, and I've also learned a lot, especially because I was first of all not very certain about what the difference between the significance and contribution is. That would be my first question. What is the difference? I still don't grab the difference between what the significance the project is and the contribution to the project, because the way I was explained or the way I was taught, it feels like it's almost the same thing. So I would like to ask that. And my second question is outcome is outcome harvesting done how do you inculcate outcome harvest results in your report? Is it that to or is it necessarily through participatory observation only that you can observe and harvest outcomes, or do you need like KAIs to be able to understand what outcomes are? Because I feel like if uh, if participants are maybe aware that you have to ask them questions for outcome harvesting, I just feel like it's going to be they're going to behave biased or something. They're not going to really act as how you intended or did not intend.
All right, I hope Professor got that question.
Thank you, Thelma, for your questions. You are pitching somehow, so I was able to get two main questions. One, the difference between significance and contribution in outcome harvesting. And then two, when we are using key informants in outcome harvesting, is there a possibility of bias? Right. So for the first question on the difference between significance and contribution, I would say that in terms of significance, we are looking at whether this outcome is something that is innovative, something that is new, or something that is out of the ordinary, right? Right. And I said that when you're looking at significance, this significance must always be tied to the program theory of change. What did the program set out to achieve, and how did it set out to achieve it? And as it attempts to achieve that, right? Did it come up with anything, say, innovative or out of the ordinary? And is it capable of being sustained beyond the lifetime of the program? That is what we really look for in significance. And in terms of contribution, we said that at the start, we said that we have those three spheres, the sphere of control. So in the sphere of control, we have our inputs, activities, and outputs at the sphere of control, right? And this is where we have our investment. We did mention that we may not be concerned so much about this sphere of control because this is things under our control as program implementers, but we'll be concerned about the second sphere, which is the sphere of influence. Who have we been able to influence to change their behavior? But that said, it is important to get the contribution of an intervention to an outcome. So how do we get this contribution? Here, we are looking at the activities that were implemented. What were some of the activities were implemented, and how do these activities tie towards the objective or the outcome that has been achieved? So we are trying to establish a causal relationship in as much as we admitted that we are dealing with complex situations where relations of cause and effect are not clear. We are trying to establish how, to what extent did these activities contribute to this? Yeah, well aware that there could be multiple actors in the same context, right? But we are only concerned with the little contribution that our activities contribute in terms of achieving the outcome. In terms of key informant interviews and bias, we said that we will be engaging people who are knowledgeable about the project as key informants, and these include even project implementation staff. So this may not be the element of bias, because even if they were to be biased, this one is simply at step number 3 of the outcome harvesting process. We talked about step 1, where we are designing and coming up with those user evaluation questions and the uses of the outcome harvest in step 1. In step 2, we are reviewing the documentation, and then in step 3, we are engaging those knowledgeable actors. So it is in step 3 where we have our key informant interviews and all the rest, but still we have step 4 where we are going to talk about substantiation. In this element of substantiation, right, identifying whether this intervention contributed to this outcome or not, we will be able to sieve out any possible biases that may have arisen in step number 3. So step number 4 takes care of the possible biases in the key informant interviews in step number 3. So that one should be well taken care of. Thank you.
Thank you very much. Please ask only one question. I can see over 10 hands that have been raised. So we got the next question to Deji Bodunde. Deji, please raise your question and keep it straightforward so that we save time. Thank you. Deji, please.
All right, thank you, Mr. John. Dr. Funge, your presentation is so in-depth and it has really enlightened me more than I've actually got involved in a workshop that has to do with outcome harvesting. But this presentation has thrown it to a higher level for me. One question I want to ask is, in the course of your presentation, it seems outcome harvesting is more tied to evaluation and less of monitoring. And I've seen cases, let me use an example, where we are doing a project where outcome harvesting is what we're using as part of our MIA approach. On a quarterly basis or monthly basis, our field staffs have been trained on how to identify outcomes, harvest it, send it to us, where we can make many out of those outcomes, like you said in the course of the presentation. And then we also use it in our monthly or quarterly or annual progress report. Now, this is not evaluation, but I think it's monitoring aspect. So can it be used? Thank you.
All right, Professor.
Yes, thank you so much, Deji, for your compliments and also for your question. I think when I was responding to one of the questions, I think the question by Adewole, when Adewole asked about whether internal staff could have a role in conducting outcome harvesting. I did mention that by initial design, outcome harvesting was designed for evaluations, but slowly and progressively, organizations are beginning to use outcome harvesting for purposes of monitoring also. And the most important thing is that when you're doing this monitoring and why they're strategically moving to adopting outcome harvesting for purposes of monitoring is because you end up implementing a project for 5 years. At the end of 5 years, the donor wants you to use outcome harvesting to evaluate the program. And then when you give a client the documentation to review, the client looks at the documentation and can't see any outcomes. What they're seeing are just activities and outputs. What we are talking about in the first sphere, the sphere of control, right? So this has made it very difficult for organizations because they're claiming, but we were able to achieve 1, 2, 3, 4. But what they are achieving are outputs because they are at the level of control. They have not been able to influence any social actor to change their behavior. And that is what the donor wants to see. What behavior have you been able to change in the persons or the actors that you have been able to influence? You end up not finding that. So why the organizations are trying to use now outcome harvesting in monitoring and evaluation is to try to see that on a regular basis, have we been able to change any behavior of any actor so that they can have a tool or a template for recording these changes in behavior. When did we notice a change in behavior in this actor, right? They record that. And how did we contribute to that behavior change? They also record that, so that when it comes to the time of external evaluation, when you are asked about the documentation, you are able to produce documents which clearly document the changes that you are able to achieve over time in the life of the project, and also how the intervention contributed to this. I don't know whether I answered you, Deji.
Okay, I hope you have been answered. Let's go to the next question, and let's keep it brief. We'll take the question from Rutendo Chandi. Rutendo, please, Nick, unmute Rutendo.
Thank you so much, and thank you to the presenter. It was a really informative session. So my question, I hope you can hear me well, is from the perspective of a donor or a funder, how do you substantiate outcomes related to your funding when a donor is not implementing the activities directly? And also, I'm just interested in knowing about this methodology, if there's like a time frame of the methodology. Like, is it something that you could use long-term, like after 5 years or 10 years? Could you still use the same metrics that you've been speaking about? Thank you.
Rutendo, I didn't get the second question clearly. Maybe you could repeat.
Rutendo, please, and unmute Rutendo, Nikra.
Sorry, I had to wait until the host allowed me to unmute. The second question, you've been speaking about a theory of change. So I know a lot of organizations I work with, their theory of change for social behavior can even be up to a decade, for example. So I'm just wondering if this is an evaluation tool that can help you be able to evaluate things over a long period of time. So for example, if you're looking at racial injustice, you know, those type of social justice issues that take a long time to actually see any change. Thank you.
Okay, thank you so much, Rutendo, for your compliments and for your two questions. One, on the perspective of a donor, when a donor is not implementing directly, how can you substantiate, right, an outcome? I hope I got you correctly. If that was your question, when a donor is not implementing directly, we have instances where a donor is, for example, using civil society organizations or even government in different countries to implement programs. The most important thing here is that we will be talking about the donor as a change agent, and also the implementing organization or implementing CSO as a change agent. So the most important thing is the change agent are supposed to influence the change actors. And it is in the change actors that where we are looking for our outcomes. And for the substantiation stage, we said that we are looking for two things. One, it could be a document that actually indicates that this outcome was achieved, when it was achieved, and how the project or intervention contributed to that outcome. And then two, we talked of the second possible substantiation source is a person, an individual, or an actor who is knowledgeable about this project or intervention and knows about the outcome, but did not take part in the implementation completely. So in this particular case, it is not the donor who did not implement directly who is substantiating, but they can help us identify other actors who are knowledgeable about this program. Maybe, for example, because you have talked of multiple actors in a context, we find that maybe Ford Foundation is implementing a program through another donor. We have, say, Ford Foundation, we have DSW, we have another third organization. What we could do for purposes of substantiation, we could, the donor or the implementing organization can suggest some of the actors in that particular context. Then we can go and ask those actors, are you aware of this outcome that this organization ABC is claiming to have achieved? They will say, yes, we are aware of this outcome. How do you think this organization contributed to the outcome? So in the substantiation process, this other actor may even tell you that, okay, we also contributed to this, but to a certain level, and the actor you are talking about contributed to this level. So in that way, we'll be able to know the element of contribution of the intervention and of other actors. And in terms of theory of change, for social change up to a decade, and you want to find out if outcome harvesting can be used over a long period of time, yes, this is particularly so, especially when we are talking about advocacy programs, and when specifically we are targeting, for example, policy change. This actually takes a very long time for even policy to change. Say, like I was giving an example of trying to influence legislators in a country to come up with policies or laws that are LGBT friendly. Yes, it takes time, but the most important thing that we can capture in outcome harvesting in the process is, for example, have you been able to have engagement with the policymakers? Yes, you've been able to have engagement with the policymakers. Have they been able to make any commitments, or are they embracing the ideas you are discussing with them? If there's any element of that, for example, they make a commitment that I'm going to come up with a draft policy or a draft legislation on LGBTI, which I'm going to present to Parliament or something like that. That is already an outcome. It is a commitment. It is a change in behavior in terms of a relationship. One, how you relate to the policymaker, so it's a change in relationship. And two, the commitment itself is a manifestation of a change in behavior. Initially, there was no commitment from any policymaker in terms of embracing LGBTI legislation. So we may not have to wait for even 10 years for that legislation to come into effect. The mere fact that the legislator has got the buy-in is enough of an outcome. Thank you.
Thank you very much, Professor. I've just noted before I talk to the next person, who is Peter Lemmy, just to clarify two things. One, someone has asked if we will send the presentation. Normally what we do is we will post the recording of this video on our YouTube page, YouTube channel. Check Strategia Netherlands, and you can subscribe so that whenever we post new videos, you are alerted. We already have about 45 videos there on monitoring and evaluation, water and sanitation, fundraising, project management. So visit our channel and you can access this video from this evening or tomorrow morning. Secondly, and I know Professor will give his contact towards the end, is this is just a snippet of outcome harvesting. If you'd like detailed training, Professor is willing to do that for your organization. And so you just contact us and he'll give you your contact and you can engage him. Thank you very much. So now let's go talk to Peter Lemmy. Please go next. Thank you. Peter Lemmy Emmanuel.
Okay. Thank you so much. Thank you, Professor Ponge, for this nice presentation. My experience has taught me that outcome harvesting is mostly used for long-term projects, especially projects that have TOC, theory of change. So my question is, if you have a short-term complex project that does not have theory of change, can we use the outcome harvesting? Thank you.
Yes, thank you, Peter, for your compliment and the question. Yes, you are right that outcome harvesting is mostly used for long-term projects. Yes, and you're asking if we can use outcome harvesting for short-term complex projects. Yes, so my answer would be yes, it is possible. We can use outcome harvesting for short-term complex projects. In as much as, for example, in the previous answer, the previous question, I was talking of a possibility of, in as much as outcome harvesting, when the outcome harvesting can be used for a long period of time. I said that even in the short term, if the context is complex, what we mentioned, what we said that the element that makes us identify whether we can use outcome harvesting or not is the complexity of the situation. Is the relationship between cause and effect linear or not linear? What about the multiplicity of actors? Who are some of the actors in the context, right? So even if it is a short-term project, but the most important thing is it is about changing the behavior or perceptions or relationships between actors, right? The context is complex, and two, we are talking about change of behavior or in terms of relationships, activities, or policies. If these two are present in that particular project, however short-term it is, we can still use outcome harvesting to evaluate it. Thank you.
Thank you. Let's go to a lady now, and I see Irene Moura. Irene, please go next. And mute you.
Okay, thank you. Good afternoon, everyone. My question is on the substantiating. What happens in instances whereby maybe you have an outcome, but in order to achieve that outcome, you've had maybe several donors contributing towards that outcome, in that for the activities implemented towards the realization of the outcome, you've had several donors, maybe multiple donors contributing to that activity, but some of those donors may not necessarily be interested in outcome harvesting. Thank you.
Thank you, Lady Irene, for your question. We're talking of substantiation in the context of having several donors making contribution to an outcome, but then the other donors are not interested in the outcome harvesting approach. Actually, the most important thing that we need to find out here is whether they can be able to, we are going to use them simply as substantiators. We are not going to use these other actors as key informants for this particular study. The key informants, we are going to engage them at step number 3, right? Where we are going to engage the persons who are knowledgeable about this. In step number 3, we even include people who are involved in the actual implementation of the project. But in step number 4, where we are talking about these other actors now, these other donors who are working in different projects but knowledgeable about this one, we are not going to use them as key informants, right? And then if we want to identify, these other organizations also claim that they've been able to make a contribution to this outcome. That would then involve us to move to a next step, where we would conduct something called a force field analysis. And in this force field analysis, we want to find out what were some of the strengths, or how many forces were there that were for this intervention or for these outcomes. How many forces supported this outcome? How many forces were against this outcome? And to what extent did this organization or this intervention work against these forces to achieve the outcome? So that would be a next step, which we call force field analysis. But insofar as these other several donors are concerned, if they adopt their own different evaluation methodologies for their own product, their own interventions, that is well and good. But what we are doing for the intervention that we are evaluating, which is for, say, organization A, we simply ask them if they know about the outcome and if organization A actually contributed to the outcome. Yeah, that's what we ask them. Thank you.
Okay, thank you very much, Professor. Let's go now to Jacob Wilson, and then I'll go to Luther and Uluch Aldo. So let's go to Jacob Wilson. Nikon, please unmute Jacob Wilson.
Good morning.
Jacob,
can you hear me now?
Yes, please.
Okay. Thank you very much, Professor, for this training. It's very much important for us, especially those of us who have just come into the M&E fold. I think it's actually something that is teaching us something what to do best in the field. My question is, we have been doing a lot of intervention in terms of changing behaviors, but we have been finding it very difficult to measure behavior change. So I want you to actually bring me up to speed in terms of how to measure behavior change, because like you rightly say that it's a complex intervention, and every complex intervention you have to be careful of what you do and how behavior are going to be changed. So I definitely want to know what are some of the measures to take in order for us to measure behavior change, which is very much critical for behavior change interventions. Thank you very much.
Thanks, Jacob, for your compliments and questions. And you are saying that your organization has been implementing programs targeting behavior change, and you have challenges of how to measure behavior change. I think for purposes of outcome harvesting, actually we may not go the extent of actually measuring behavior change, but what we are concerned with in outcome harvesting is the identification or the manifestation of behavior change. So we talked of behavior change as being manifest at 4 different levels. One, it can be at the level of relationships. Has there been a change of relationship between the actors involved in this project? Say in this particular case, the change agents and the organization or the institution or the people they are targeting to influence. Has there been a change in that relationship? If there's a change in relationship, that is or noted as an outcome because it's a change in relationship. Two, has there been a change in the activities, right? Has there been a change in the activities of the social actor, the organization or institution that we have influenced through our intervention? Has there been a change in the activities or actions? If there is, then we note that as an outcome. Has there been a change in perception regarding something, for example, say about a change in perception of religious leaders about say something like abortion, because you find some Christians are against abortion, and then maybe you have a program which tries to bring or sensitize the community or the religious community about the need for abortion in exceptional circumstances, and then you find that the Christian community start to have a buy-in and say, oh yes, sure, we can have abortion in this kind of context. So if there is that change in perception, then we note that as an outcome. But actually measuring the level of change may not be possible for outcome harvesting, but what will be possible with outcome harvesting is the identification of that behavior change. Thank you, Jacob.
Thank you very much. The next question is Luther Das. Has been waiting for some time. Luther Das, please raise your question. Thank you.
First, I want to thank you for this really intellectual, cognitive subject and discussion. In the narrative, I find at the level of outcome, when you talk about outcome, you go out of box. And you said, capture all outcomes. And at the same time, you embrace the word complex. Two questions is obvious. One is, what is the definition of all? What do you mean by all? One. And on the other side, if you capture all outcomes, what about the inputs? Why not? Why we did not talk about all inputs? For example, the money, the machine, the material you input. Besides that, there are other things. For example, if you have a rice farmer improvement project, then in last 3 years in prime time, there was less sunshine. So whatever your inputs are, this sunshine will be substantial enough to reduce your production. For another example, Ukraine war, they have figured out many factors, but they did not they could not figure out what the role will be of different countries and when that role will be. So let me come to the question. What is all? What is all? How do you define all? And why you exclude all limited number of inputs?
All right, Professor, floor is yours.
Great. Thank you so much, Brother Luther Das, for your compliment and also for the questions. You're asking why capture all outcomes, and then also we mentioned the element of complexity, right? So when I mentioned about capturing all outcomes, it was because when you are in step 2, in step 1, you've talked with the client and you've come up with the evaluation questions. You know the evaluation users and what you want to do with the evaluation findings, the outcome harvest, right? Then you are given the documentation. In step number 2 now, you are reviewing the documentation. As you are reviewing this documentation, the purpose is to capture all the possible outcomes that you are able to identify from this documentation, right? Yes, anything that you see as a change in behavior, note it down. It's a potential outcome. What I'm saying here is potential outcome. All that we are talking about, all outcomes in this particular case are potential outcomes. Everything that we capture in step number 2, we will still subject this to step number 3, where we will be talking with the key informants now in terms of trying to dissect whether these outcomes that we mentioned or we came up with in step 2 are actually outcomes of this intervention, or they could be outcomes of another intervention. Through that step 3, we'll be able to see what does not belong to this intervention. We still go a step 4. Whatever we remain with in step 3, we take them to step 4, where we are going to subject them again to substantiation. In this step 4 again, some of the potential outcomes we picked in stage 2 may be dropped at this stage 4 in the process of substantiation, either because they are not outcomes of this intervention, they could be outcomes of another intervention, but they appeared in the documentation erroneously. right? So they'll be dropped in step 4. So that's what I meant by capturing all. Anything that appears as an outcome in the documentation, we capture it as a potential outcome. But being a potential outcome, not all potential outcomes will end up being outcomes of the project. By step 4, by the time we finish substantiation, we shall have sieved out any outcome that does not belong to the intervention. And then your second question is about inputs. Why not capture all inputs? Why exclude inputs and yet capture all outcomes? My answer to this would be, I'll still refer you back to the 3 spheres, where I talked about the sphere of influence, the sphere of control, which is at the program implementation level. This is where we have our inputs, activities, and outputs. What we have at this level where we are injecting our investment or our resources, what we have at this level are outputs. You saw the first level sphere of control, we have outputs. But for purposes of outcome harvesting, we are not concerned with outputs. We are concerned with outcomes. And that's why we move to the next level. What have you been able to influence through your activities, inputs and outputs in this level 1, sphere 1? What have you been able to influence in level 2? So that is the level of concern for us in outcome harvesting, the level of influence. I don't know whether that answers your question, Luther. We are not excluding the inputs. The inputs will become necessary when we go to the level of now trying to identify how did this outcome, how did this intervention contribute to the outcome? At that level, you'll have to bring in the inputs, activities, and outputs, and how these are linked to the outcome. Thank you.
All right, thank you very much, Professor. So let's go now to Yasmin. Yasmin Boba.
Hello, everyone. Hello, Doctor. Thank you for such insightful presentation. I just wanted to, I had 2 questions, but one of them has been already answered. From what we hear, we see that it's not about behavior change and influence, which is very difficult to measure, as we know. Would you recommend or advise that we just use the qualitative approach, or can we use mixed methodologies for data collection?
Yes, Yasmin, thank you for your question. And if I got you right, you are asking about behavior change and how we can measure this, and whether we should use qualitative approaches instead of quantitative. Did I get that right, Yasmin?
Yeah, exactly. No, I was just saying that I just noticed that it's lots focused on behavior change and influence. So I'd like to know, would you advise us to just go through qualitative approaches, or can we just use mixed methodologies, which are qualitative and quantitative approaches?
Yes, in this particular case, I would advise mixed approaches, in as much as it would be difficult to measure the extent of behavior change. What we can do in this particular case can be twofold. One, we can have, say, a survey targeting the actors who are supposed to be influenced or whose behavior was supposed to be changed as a result of the intervention. We can have a survey, say an online survey, or whichever way you conduct the survey. And from this survey, you'll be able to get quantitative data. For example, we were able to influence the behavior change of this number of boys and girls, right? But then the challenge would be, how are you going to substantiate that there was actual behavior change? Because in the survey, they can just say, yes, my behavior was influenced, but how will you determine that there was a behavior change? This is where now the qualitative aspect becomes extremely necessary, because for the qualitative aspect, you are able to subject this through the substantiation process, right? Through documentation as well as interview with these potential substantiators, right? But it is equally possible also with the quantitative survey, where it can be established. For example, a substantiator can say that, yes, I'm sure that we were able to influence the change of behavior of, say, 600 or 1,000 or 2,000 boys and girls towards safe sex or something like that. Yeah, it is possible. So you can decide to use both, but the challenge would be substantiating the quantitative data that you generate through the survey. Thank you.
All right, thank you very much. Let's have Shadrach Gideon. Shadrach Gideon, please go next. We need to wind up this session. Shadrach Gideon, please go next. So we'll only take 4 more questions. Shadrach Gideon, Herbert, Ishaku, and Kennedy Odera. And then I will invite my colleague, Victorine, to briefly talk about our courses. And then we'll do final remarks from Professor. So Shadrach Gideon, please go next.
Maybe just 1 minute, John.
Yes, please.
I've seen that there are so many messages. I wasn't able to go through all of them as I was listening to this. Maybe if you will save the chat, so that I'll be able to go through them. I see if there are some questions which I was not able to respond to, as I mean, they did not get a chance to ask their question, but they asked through a chat. I could be able to respond to them and share with you. Alternatively, if I answered them, then that would be well and good. And then also maybe if you have, I do pray you have the email addresses of all those who have attended, you can be able to share with them the slide.
Yes, we have the emails, and we'll share that with you. Nikron, please copy the chat so that we can share with the professor. It's good for even for learning purposes to know which areas to improve. Thank you. Shadrach, please go next.
Yeah.
Shadrach, okay.
Okay. Yes. Thank you very much, Doctor, for that insightful presentation. So I'm interested in actually knowing, though I joined in late, the sampling for outcome harvesting. Is there any right way of doing the sampling, or there's a structured way in actually determining sampling of the participants and how to determine that? Thank you.
Yes, thank you so much for this question. It's actually an interesting one, whether we have any structured way of doing sampling for this. But my answer would be that this one, it may appear subjective, given that you have to engage with the client. It is the client who is supposed to mention or identify to you some of the key actors that you're going to engage in step number 3. But that said, from the documentation itself, you will be able to identify some of the outcomes from this documentation. And it is again from the same documentation that you'll be able to identify some of the actors you think are critical to these outcomes. And maybe based on that, you'll be able, you'll ask the client to give you access to these actors based on the review of the documentation, as well as that's step 2, as well as how you engage with the key, the program implementation staff in stage 3 and any other stakeholders. So it may look like a snowballing method, but there's no actual definite structured way of sampling for this. Yeah, but maybe I can stand guided if anyone has come across any structured way of sampling for outcome harvesting. Thank you.
All right, thank you very much. Herbert Kalesu, please go next. Please unmute Herbert. Herbert, we're waiting for you. Herbert, please go, please raise your question. Herbert? I think we've lost Herbert. So let's go to Ishaku, please. Ishaku Abbas.
Thank you very much, Prof. Can you hear me?
Yes, please.
Yeah, thank you. Mine is not actually a question. I actually joined late, but I wanted to contribute on the issue of how to measure behavior change. If I may try and contextualize it with a typical project that we're implementing here in Nigeria, WASH projects. Maybe, for instance, community-led total sanitation, where we sit with people, analyze their situation around open defecation practice. So on the input level, we can say we want to measure number of communities that we triggered using the community-led total sanitation approach. So we are measuring number of communities. So on output then, we'll be looking at number of households that have constructed and are using latrines. Let's say if we are targeting a ward or local government area. And then in outcome, we'll be measuring number of communities that have stopped open defecation. Meaning you go around and then see there is no open defecation practically. This is all about behavior change. Prior to the intervention, they were practicing open defecation. So when you trigger them, households begin to construct latrines and they are using it. And then in outcome level, you'll be measuring number of communities that are totally open defecation free as a result of this intervention. So by the time we get to impact level, we'll be measuring a number of maybe disease reduction, prevalent diseases reduction at impact level. So as a result of communities stopping open defecation, the prevalent diseases that were then disabling the community will have reduced. So that's my little contribution. I think if we can contextualize it, we know behavioral change is a process and it's difficult to measure, but then there are ways we can handle that. Thank you so much for this session.
All right, I think Professor can respond.
Thank you so much, Ishak. At least that is really a good example of how we can measure behavior change. And I think we can adopt this for similar projects targeting behavior change in different contexts. Thank you.
All right, the last question is from Oluch Aldo. Please go next. Oluch.
Thank you so much, Professor. It is a very interesting learning that I pick from this. I'm still wondering something around step 5, where we are talking about analysis of outcome. You said we categorize outcome based on objective, or we can use OECD or DAS criteria. So I'm now trying to look at the efficiency as one of the criteria. I'm wondering how and we present our reports or findings under this criteria, especially where we are looking at the money, the value for money. How can it be reflected using this methodology? Thank you.
Okay, Professor. Oluwach Aldo.
Yes, thank you so much, Oluwach. It's Oluwach with a W. That must be our brother who got lost somewhere. Oluwach, you're from Kenya? Either from Kenya or Sudan, most likely, our brother. Right. You are saying rightly that outcomes should be based on objectives. And then you're asking, how can we present our findings using the OECD DAC criteria? Right. What I can say is that when we are coming up with these outcomes, we are reviewing the documentation and we are coming up with any potential outcomes that are there in the documentation, right? Some of these outcomes may be of this intervention we are evaluating and some may be not, right? But what we are saying is we capture everything. For outcome harvesting, it starts from the outcome. What is it that has been achieved? That is what we are concerned with. We are not concerned with whether this was intended or unintended. And that's why we are saying for outcome harvesting, we can capture all outcomes, whether they were intended or unintended, whether they are positive or negative, we will capture them. But then now, through the rigorous process of outcome harvesting, all the way to the substantiation stage, that is where we'll be able to sieve out those outcomes which do not belong to this intervention. But in terms of objective, I was saying that this one will help us now when we are doing the stage number 5, analyzing and interpreting the outcomes, right? It is at this stage where we are going to categorize these outcomes. And I said we can categorize them, one, based on the objectives, right? Which are these outcomes that fall under objective A? Which of these outcomes fall under objective B? Which outcomes fall under objective C? That's one way of categorizing them. Another categorization we said can be through the OECD DAC criteria, depending on what a client wants. Maybe a client wants us to report on efficiency, effectiveness, relevance, coherence, and all that. So we look at the outcome and then we try to check, does this outcome, does this behavior change manifest the efficiency of the implementation of this project? If it does, then we place that outcome under efficiency. So that's another way in which we can categorize the outcomes. And then the third way in which we talked about categorizing is based on emerging themes. What are some of the emerging themes based on the trends analysis, from the outcomes, right? So we can also categorize those outcomes based on those emerging themes. Right. So it is possible to present our findings using the OECD DAC criteria. The most important thing is identify the outcomes, let them go through the process all the way to substantiation. Then after that, in step number 5, try to categorize them based on where they fall. Thank you.
All right. Thank you very much, everybody, and for your patience. We are learning so much. At this time, at this stage, I'd like to invite Victorine from Strategia Netherlands to briefly talk about our courses. And then I'll also ask Professor to give some closing remarks. This is just a snippet of outcome harvesting. There's a whole training program which he can offer to your organization. So he'll tell us about that in a minute. Victorine, please.
Yes, thank you, John. Am I clear to everyone? Can you hear me?
Yes.
Perfect. Hi, my name is Victorine. I am the training manager at Strategia Netherlands. We're part of the organizers for this event. And I just want to take a bit of your time to explain about what else we have to offer beyond just this course. If Nick could please allow me to share my screen. Right, so Strategia Netherlands, I'm sure John has mentioned it quite a bit. We are a training organization based in the Netherlands, and we focus mostly on occupational training within the humanitarian field. We have a number of different courses that revolve around this area, like monitoring and evaluation, which Dr. Wu has been generous enough to take us through the session today. And we've also trained a number of different people in this field across multiple countries. For example, we've trained workers and employees from USAID, the World Health Organization, the Ministry of Health in Kenya, and Kengen. We have a number of different courses beyond just monitoring and evaluation. For example, grants management, we have water, sanitation and hygiene, project management, public health, conflict management, disaster management, among many, many others. So if you're interested in finding an exhaustive list of some of our course offering, you're welcome to have a look at our website, that is strategianetherlands.eu. Now, the courses are kind of categorized into three main categories. We have certificate courses. These go for 3 months at the cost of 400 euros. We have diploma courses that go for 6 months at the cost of 800 euros. And then we have postgraduate diplomas that go for 1 year at the cost of 1,200 euros. Now, we focus on occupational training, which means that most of the people who are here, you're professions. You may not have the luxury of having to sit down in a classroom for 8 to 5, for example. So our courses are very self-paced, and they're delivered through this exact same channel where you can sit down with the likes of Dr. Ward and John Karegwa, and then they teach you through there. It's also self-paced, meaning that you're in charge of your own schedule. So depending on what part of the country, the world you're from, if you're in Kenya, if you're in Afghanistan, if you're in the UK, if you're in the US, and you need a very flexible timeline of actually getting this information, this is possible. We have 2 intakes every month. That is the 1st and the 15th of every month. And anyone that is interested in registering or gaining more information of what we have to offer and when the intakes are, you're welcome to share or send an email to info@strategianetherlands.eu, and we'll be happy to provide most of this information. Now, for the lucky people within this webinar today, we're offering a 20% off on all courses for the July intake. All you have to do is just maybe quote that you are part of this webinar today, and then this discount will be applied to your tuition. We've talked about how you can get in touch with us or get in touch with Dr. Wu. So you're welcome to use the email address again that's on there. That is info@strategianetherlands.eu, or you can visit the website at strategianetherlands.eu. Yeah, thank you. I don't know if there are any questions at this point.
Thank you. Thank you very much, Victorine. At this stage, I'd like to invite Professor Ponge to give some closing remarks and to tell us about the extended training program, and then I'll give a vote of thanks. Thank you, Professor. And I must say from this end, I want to thank you, and we are really grateful for this. It's been an eye-opener because this is a new area in M&A, and I think we've all learned a lot. Thank you, Professor.
So, just to thank you so much, John, Victorine, and all of you participants. Thank you so much for giving me this opportunity to share with you on this emerging participatory approach to monitoring and evaluation. I don't know whether John had something like a feedback, or maybe you could develop a feedback form and share with the participants so we could know about maybe whether the expectations are fulfilled or not fulfilled, and any areas of improvement in future trainings or webinars like this one. So the people could give feedback, could share with them through their emails. I will also share with you the slide presentations, at least by close of business today. I told you I had just traveled to the field and not anticipated this, and I had to dislocate someone from his office so that I could have this. Yeah, so I'll share with you late in the evening once I settle down. Then I wanted to mention that I'm available to conduct in-depth training. Actually, the outcome harvesting training takes like at minimum 3 days, but the ideal situation to have also a hands-on feel of the process should be 1 week. But in most cases, what organizations have been doing is that they give you the terms of reference for conducting outcome harvesting and realize their staff are not knowledgeable in outcome harvesting. So as part of the assignment, you take like 3 days to train them in outcome harvesting, the team, before you start conducting. So I'm available to conduct. I may not be available to conduct on individual basis, but for this, I can leave it to Strategia Netherlands to see if there's demand for this, and we could do it for say 3 days or 5 days. Then we can see how we can structure this through Strategia Netherlands. And then lastly, I was joining this in my capacity as the Vice President of the African Evaluation Association. Actually, John got me from that when I made a presentation to Uganda Evaluation Association. It is part of our mandate as members of the board of the African Evaluation Association to build capacity of evaluation practitioners in the continent of Africa. So it is one of our way of giving back to the community. So I would request that you join a voluntary organization for professional evaluation in your country, the different countries where you operate from. And as a FREA, if once you join, say, Uganda Evaluation Association, and the Uganda Evaluation Association pay the corporate membership to AFREA, then anybody who is a member of Uganda Evaluation Association, by extension, becomes a member of AFREA. So if your VOPE organizes a webinar like this and calls any of our board members or any member of AFREA to come and offer such kind of training, we will willingly come and offer such kind of a webinar free of charge. But it may not be the in-depth training that you may require for practice in outcome harvesting. But all the same, for VOPES, we do it for free. But when you want the in-depth training now, you can liaise with John, and he'll be able to give you directions going forward. Otherwise, I just want to thank you so much for giving me this chance. And let us continue engaging on LinkedIn or by mail. Actually, before I just joined, I found like I had 8 mails. I couldn't respond to them. They were asking for the link. And it was not possible for me to share with them the link at that time. But I pray that they'll be able to get the link from John. Otherwise, thank you so much, everyone, and have a wonderful day or evening or night, wherever you may be. Thank you.
Thank you very much, Dr. Ponge. It was indeed a very big honor for you to participate in this session. I realized, you know, the world, we have a big community all over the world. You've seen Pakistan, Afghanistan, India, Zimbabwe. So we have a community, and we wanted them to also, you know, learn something in these new emerging trends. So we thank you very much for the time, and we thank everyone for participating in this session. The video of this session will be uploaded on our YouTube page. Check out Strategia Netherlands on YouTube and subscribe so that when we upload new videos, you'll be alerted by YouTube. There are already about 45 other videos there for different courses: monitoring and evaluation, project management, proposal writing and fundraising, water and sanitation. So please subscribe, and you will keep you updated. I want to thank all of you for taking your time. And I would also like to thank our team that did the marketing and putting together this webinar. There's Walter, of course, Nikron, Damaris, and Victorine for the presentation. I thank you and wish you a good morning, good evening, good afternoon, wherever you are logging from. And we'll keep updated. We will have another session next month on 15th of July. And we'll invite you on data management. So thank you very much for the continued support, and let's keep it strong. Great day. Have a great time, and thank you for the good work you're doing for your communities. Thank you, Professor. Bye-bye, everyone.
Thanks, John, and bye-bye, everyone.
Bye.
Bye.
Are you interested in building a career in the development and humanitarian sector? Then, Strategia Netherlands is the best option for you. We offer training solutions to the United Nations, governments, NGOs and other development organizations worldwide. Make your online application now for Diploma in Monitoring and Evaluation, Diploma in Grants Management, Diploma in Conflict Management, Diploma in Disaster Management, Diploma in Water, and many cost 1,200 euros. Visit www.strategianetherlands.nl for more information. Did you know that 67% of Africans don't have access to proper housing, 56% have no access to water, and 79% have no access to food? These are the grim statistics of challenges facing Africa today, even as the continent works to develop. This development we have been leading the charge in changing Africa's fortunes. We are the leading development training company in Africa, offering institutional training solutions and online and distance learning in business, development and humanitarian courses. Over the last 10 years, we have trained over 10,000 staff from NGOs, governments and the United Nations in Africa. Our catalog consists of over 200 career-focused online courses to choose from, and registration for diploma and postgraduate courses is now open for the following courses: Postgraduate Diploma in Monitoring and Evaluation, Postgraduate Diploma in Water, Sanitation and Hygiene, Diploma in Community Development, Postgraduate Diploma in Strategic Planning and Management, Postgraduate Diploma in Grants Management, Diploma in Project Management, Diploma in Nutrition and Dietetics, Diploma in Gender and Development, Diploma in Leadership and Management, Diploma in Finance Management for NGOs, and many more. We have also partnered with the European International University to offer an executive MBA. Once you register, you will have access to our team of experienced trainers and specialist consultants who will guide you on your course whenever you need them. The cost for diploma courses is $800, while postgraduate courses cost $1,200. The cost of a one-year MBA course is 1,500 euros. Visit www.capacityafrica.com for more information. It's no secret that Africa is the next frontier, and you can be the next big investor. At Strategia Business School, we'll offer you a monthly masterclass that will help you build your network among respected entrepreneurs and business leaders and guide you on the opportunities available and how to mitigate any challenges of investing in Africa. Our African Business Club will also introduce you to our team of African business mentors and fellow investors, all tailored to your very own needs. Among the modules covered are doing business in Africa, raising investment and trade finance, importing from Africa and exporting to Africa, agribusiness opportunities in Africa, and understanding the African market. You can also register for online diploma business courses with a flexible learning schedule. Some of our courses include Diploma in Digital Marketing, Diploma in Sales and Marketing, Diploma in Finance Management, and Diploma in Logistics Management. Certificate courses run for 3 months, while diploma courses run for 6 months, and you can register at the beginning of every month. The cost for certificate courses is 500 euros, while diploma courses cost 800 euros. Take action and register today. For more information, contact info@strategiabusiness.com or visit www.strategiabusiness.com.